Hello, I'm Dr. Dailey here. I hope this video finds you happy and healthy. Today we're going to talk about our next step. And when I say next step, that's after we've done the Clear Bite protocol and after we have determined what foods we're allergic to through the elimination diet and the reintroduction part of that diet. Now we're going to talk about the 4 R's for regaining optimal digestive health. 4 R's for regaining optimal health would be number 1, remove. Number 2 would be repair. Number 3 would be restore. And number 4 would be re-inoculate. And I'm going to explain this. And again, I do the video so I could spend a little more time with you and explain the process, where in the clinical setting sometimes I just don't have that opportunity. And this is also something that you can save and watch again and again. So let's talk about remove. Most of us grew up on a diet of refined food that are very low in fiber. The result is an increase in the amount of time that food actually spends in our digestive tract. In addition to this, there are a lot of other habits like not drinking enough water and limited exercises and exercise in general that contribute to a slowing down of food transit time in our bowels. Food matter that's stagnant in the colon can, over time, become compacted against intestinal walls. This can be removed by doing a colon cleanse naturally. And the colon cleanse can remove some of the oldest, most compacted food matter. And you can actually look into a colon cleanse where they do a coffee enema or something like that. And there are a few places in town that can do that. Of course, we don't do that here in our clinic. We use an internal approach, more natural. And the fiber, which is one of the things that we use, acts like a broom that sweeps through your intestines, keeping them clean. Fiber also helps you become more regular, which is very important for good gastrointestinal health. Popular forms of fiber might include wheat bran or psyllium husks. However, these fibers can bloat some people, and if you're sensitive, which of course most people are that are part of our program, that's not necessarily good for you. Other popular, more gentle forms of fiber might be rice bran, oat bran, pectin, flaxseed, cellulose. The list goes on. And there are actually some that aren't bad you can buy at Walmart, but we're going to do things a little bit differently here. We'll probably do that with our high quality supplements, but along with the old food matter, you'll also want to remove any abnormal bacteria, fungus, parasites, yeast overgrowth. And this is something that if we've done advanced testing with you, we would have seen in those advanced tests. Now, for some people, we make some assumptions that perhaps they do have parasites, for instance, and we start you on a protocol to help actually accomplish that. Then the second step would be repair. Repairing the gut lining is extremely important. The integrity of your intestinal lining plays a crucial role in your health. You want to let the good in and keep the bad out. An injured intestinal lining can become leaky, allowing partially digested food into your bloodstream to be absorbed. This is commonly called or known as leaky gut syndrome. What happens is the partially digested food, once absorbed, can trigger an immune reaction and lead to food allergies. But it can also lead to food sensitivities. So think about it like this. If a larger than normal protein gets from your gut into your bloodstream, your immune system recognizes those as foreign invaders and tags it for attack and destruction. So once it's tagged, the other side or half of the immune system will attack it, which creates systemic or system-wide inflammation. This system-wide inflammation not only affects the gut, but it can affect your joints and your muscles, causing aches and pains. That's why some of you have migrating pain. One day it's your ankle, one day it's your knee, one day it's your neck. It just bounces back and forth. If we don't address the integrity of your gut lining and we allow this inflammatory process to persist, eventually it leads to brain fog, which for those of you who have had fibromyalgia or know someone who does, that's kind of a symptom that they suffer from, called fibrofog, fondly. So luckily, the lining of the gut is consistently renewing itself, and therefore the gut lining can repair itself fairly easy under the right circumstances. So to heal the gut lining, first we want to remove any food items that are offensive and that might be irritating your gut or make you feel tired. Common foods are wheat, gluten, and dairy. Now, we covered that in large part during our Clearvite protocol, during our reintroduction, so we should have by now established what foods we're sensitive to. So of course we're going to remove those. Secondly, we want to take the proper nutrients to aid in the repair or soothe the inflammation. We did this in part with the Clearvite, but now we need to continue the process. Now, moving on to step 3 of the 4R protocol is restore. Here we focus on restoring optimal digestive function. Now, I'm only going to mention a few pointers here because there's several things we want to do. But firstly, and this is very easy, we want to learn to chew your food properly. Chewing not only breaks your food into smaller pieces, it also mixes it with digestive enzymes in your saliva and signals your digestive system that, hey, food is coming. Second, a digestive supplement may dramatically assist you in proper digestion of your food while your body is busy rebalancing yourself. And for that, we have several things that we want to introduce. One digestive enzyme supplement may be taken with each meal. And we may actually do 2. Now, raw and fermented foods are naturally high in enzymes. So we're going to try to increase our daily intake of these foods, which again, we already have in large part by changing our diet. Thirdly, we want to eat smaller meals more often. This puts less of a burden on your digestive system. So we're going to try to eat meals in a relaxed environment. Enjoy your food. This helps aid in digestion. We want to try and drink your fluid a half hour before or 2 hours after a meal to help those digestive foods to not dilute the digestive enzymes and the digestive acids that are very important for proper digestion. Then number 4 of the 4R protocol is we want to re-inoculate. Keep this in mind, and we may have talked about this. You carry about 1 trillion or approximately 2 kilograms of bacteria in your gut. This can consist and should consist of good bacteria, bad bacteria, and indifferent bacteria, all fighting for dominance in your gastrointestinal tract. The good bacteria play a vital role in digestive and overall health. They're known as intestinal flora or probiotics. Now, these probiotics help you digest your food. They make certain vitamins. They inhibit the growth of bacteria. They reduce inflammation and assist your immune system. Keep in mind, we've discussed this probably in the past, but 80% or roughly 80% of your immune system is located in your digestive tract. So how important is this? For this, we will be using a high-quality probiotic. We're going to take that supplement in the morning or in the evening, at least 2 or 3 hours after your meal, because in this instance, we don't want the highly acidic digestive acids to kill the probiotics. So there you have it. We're going to do the 4R program, and the 4R program is not all done at one time. We're doing it in 4 steps. So we want to remove the sensitive foods that create the inflammatory process. We want to remove yeast, fungal infections. We want to remove pathogenic bacteria. We want to remove parasites. All of those things cause inflammation. Without the removal of those, we can never restore gastrointestinal health. And we want to repair. We want to repair the damage that's been done over the years to the gut lining. We want to restore. We want to restore the good bacteria. And then we want to restore the gut lining. And then, of course, we want to re-inoculate the good bacteria and allow the gut to heal from the inside out. Now, with that said, keep in mind, gastrointestinal health is vital. 80% of your immune system is in your gastrointestinal tract, and also almost 80% of your serotonin is produced in a healthy gastrointestinal tract. So the serotonin is what you might call the happy neurotransmitter. It is something that they have found lacking in depression. That's why they give you a serotonin uptake inhibitor to allow serotonin to exist in the system longer. And also serotonin is a signaling neurotransmitter, so it actually helps to signal the other neurotransmitters where to go in your body. So again, very, very important. Hippocrates said that disease starts in the gut, and I believe it's true. That's why we're spending so much time on the health of your gut. Thank you so much. Proud of you. Glad that you're involved in the program. Remember to stay the course. Great things are happening inside you, and great things are ahead. Thank you, and God bless.